Well, Dr. Emefa Dzide is a doctor here on the Drive with the Area Gang, and we're back. Doctor, you're welcome.
Thank you.
How have you been?
busy at work.
Yeah. And then there were I think last week was a holiday.
Yeah. And
so
the week before, I was very crazy.
Yeah. I was told that you were swamped with a lot of activities at the hospital.
Yeah.
But you're welcome back.
Thank you.
It's always nice to have you. We're going to be treating something very interesting today, but let me just remind our listeners that we are making room to take up more of their concern. So what we're doing is that subsequent programs would be going through some of our listeners' concern, and we'll try to address them as well as the topic that we're treating for the week. So if you have any health issue that is bugging your mind that you want doctor to have a look at, you can send us a WhatsApp message, you can send us a text message on 0505751151, or on any of our social media platforms. You can just leave a message over there and then just target Hello Doc, and on Monday when we come, we'll go through some of them and try to address them before we go to our topic for the day. Also, concerning the topic of the day, if you have a message, if you have a question or contribution, or if you have an experience that you want us to know about, you can send us your message whilst the show is going on. You can leave it on our live stream on Facebook. So Hello Doc is streaming live on Facebook, so you can leave whatever concern you have on our live stream on Facebook, and you can also leave your WhatsApp message on 0505751151, 0505751151. We'll try to attend to as many concerns as we are able to. Today we're talking about diarrheal disease.
Yeah.
It's a personal challenge of mine. I always have diarrhea. I don't know why. I almost always, like, if I tell you I have diarrhea, it's like no news, like, oh, but you could do the every time you're having diarrhea. But I don't know if there is a normal kind of diarrhea and there's one that, I was doing a little bit of reading, and I'm told that it's actually sort of a killer disease, especially in kids the world over. I don't know if that is the case, but let's get some information on it, doctor. So when we say diarrheal disease, what are we referring to?
Okay, let me just define diarrhea.
Okay.
Diarrhea is when you have frequent loose stools or watery stools more than 3 times in a day.
More than 3 times in a day.
So just one loose stool doesn't mean you have diarrhea.
Okay.
But if it is frequent or more than 3, then you can say you have diarrhea. Yeah, and
mine, sometimes I have like 5 in the morning.
Yeah, so then that would be a measure of the severity of the diarrhea. Someone can have like 10 within a few hours. That's more severe. But maybe you just have 3 during the day. Okay. Yeah, you can still say it's a diarrhea, but maybe it's not that severe.
Okay.
Yeah.
Okay. So that's a definition. If you haven't loose to more than 3 times in a day, then you have diarrhea.
Yes.
Okay.
Yes. So there's the acute diarrhea, and then there's the chronic one or the persistent one. So acute, usually it goes away within a day or 2.
Okay.
And that's the commonest kind of diarrhea. And in fact, almost everybody has at least one episode of acute diarrhea every year. Okay. With children, probably we can say like twice a year. Yeah. So it's something that goes on. It's when it's more chronic, then that would probably point to either a disease condition, maybe an autoimmune disease, or maybe you are lacking some enzymes within the tract that's not able to break down certain things, and then it's causing more fluid, and then you have watery stools.
Okay. So you're saying that if I have diarrhea once or twice a year, not really a big deal.
No, not
really a big deal. Okay. But if it's chronic, if it's persistent, then that is where
you should go to a hospital and then get checked out.
Okay. Yeah. Now let's look at, because like I said, I was doing a bit of reading, and I'm told that it's actually more severe in kids than adults. Is there any reason why children are more at risk contracting diarrheal disease?
With diarrhea, its effects are more pronounced in children. Okay, because of dehydration, because of the loss of fluid. Compare you as an adult to like a baby losing a lot of fluid, right? Looking at the ratio of body to fluid and all that, if a child has like maybe 3 loose stools compared to an adult having 3 loose stools, the child has actually lost a greater percentage of fluid from the body.
Okay.
And usually when the children get diarrhea, the smaller the child is, the higher the chance of dehydration within a shorter period of time. And especially when they are malnourished.
Okay.
So they tend to have more severe symptoms, and they can go down, like they can become very ill within a shorter period of time.
Okay.
Yeah.
Okay. Now I get it. Do we have different types of diarrheal diseases?
Well, there are a lot. There are diseases that have as significant symptom is diarrhea, but diarrhea in itself has other causes. So if it's a bacterial or a viral cause, so we have cholera, dysentery, we have giardiasis, which is a bit common but not so common.
What's the name again?
It's giardia. It's usually from maybe contaminated water sources.
Okay.
It's an organism in the water that causes diarrhea.
Okay.
So yeah.
And these are bacterial or
yes,
viral?
These are bacterial. Okay. Yeah. Usually the viral ones, usually rotavirus, adenovirus, they occur more often in children, and they are like the commonest causes of diarrhea that people have.
Okay.
It's just a viral diarrhea, and usually it's within 2 days.
It passes, just a phase.
Yes.
Okay.
The body's immune system is able to clear it out.
Okay.
Yeah.
But the other ones that you mentioned cholera, you mentioned dysentery.
Yes.
Those ones, do they pass also, or you will need to?
No, those ones, they are more severe, and then you need treatment. They would cause a more severe diarrhea, and I think later we'll talk about the symptoms of severe.
So I want to get some understanding, right? Because you mentioned some different types. What are the primary causes of diarrheal diseases?
So aside what I mentioned, those are the viral and the those are the infectious causes.
Okay.
But we have toxins in food, so food poisoning like this. So there could be some toxins, some things inside the food that would irritate the GIT, the tract, and then would lead to diarrhea, and sometimes also contaminated drinks and stuff like that. Another one is, I mentioned, when you don't have certain enzymes in your GI tract. So we have the lactose intolerance.
Yeah.
So there's an enzyme that helps to break down the lactose, that's the sugar within dairy products.
Okay.
It breaks them. So in lactose intolerant people, they don't have that enzyme, and so if they take anything dairy products, they have a diarrhea. And also there's people who can't also break down fructose, which is usually in fruits and honey.
Okay.
So when they take those kind of things, then they also have diarrhea. And then there's what we call celiac disease, where they don't have the ability to break down gluten, which is the protein found in wheat. So flour, any food made with flour, if they take it, they have bad diarrhea.
I didn't know that.
Yeah.
Okay.
Yeah. So, and also drugs, as a side effect of drugs, especially magnesium containing drugs. So if you're taking some supplements with a high amount of magnesium in it, or sometimes the magnesium trisilicates, those kind of things.
Okay.
Sometimes it can also.
So I have this how do you call it, allergy, right? To nuts, cashew nut and all that. And whenever I have allergy and I take the antihistamine, right?
Yeah.
Then I have some tummy upset. Then I take those tricyclicate and stuff.
Yeah.
Then I have diarrhea.
Yes.
That's a consequence of it.
The magnesium actually increases the motility, so the speed at which the GI tract moves.
Oh, okay.
Yeah,
now I get it.
yeah.
I didn't understand.
Also, some other drugs, some cancer drugs and some other treatments for autoimmune diseases also cause diarrhea.
Okay.
So, yeah.
You mentioned, so I'm guessing the main symptom will be the watery stool. Do we have any other symptoms?
Other symptoms, sometimes there's bloating, a lot of gas, sensation of gas bubbling in the stomach, and then cramps, especially they feel as the cramps before they have the need to pass the stool. So when the cramp comes, then you need to go to the washroom.
Okay.
And then sometimes there's associated nausea. So like you feel like vomiting, but the vomit is not coming out. Yes. So that's commonly what comes with the acute diarrhea.
Okay. Yeah. Okay. How do you diagnose diarrhea? Are there any specific tests that you do to diagnose diarrhea?
Well, diarrhea in itself is not really a disease to be diagnosed. It's very clear what diarrhea is. But what we do in the hospital is we'll try and find out the cause of the diarrhea. So that's what we are trying to diagnose.
Okay.
So most of the time, we can just get that from maybe getting the characteristics of the stool and the symptoms. So like cholera, you usually have a whitish rice water looking stool, and this is usually associated with a lot of vomiting.
Okay.
And also the dysentery, that one you see there's some mucus mixed with the stool and it's bloody. So that one, you don't necessarily need to do lab tests per se.
Okay.
But you can do some other tests, full blood counts, stool tests, to try and identify the exact bacteria that is in the stool and all that. And sometimes we do hydrogen breath tests. That's if it's lactose intolerance and those things, we have a special test for that.
Okay.
And if maybe yours is probably very chronic, we might want to do an endoscopy. That means we would use probably a gadget. Now, if I say gadget, it might seem big, but it's actually
no, but it's big. It's one of the things I dread,
Yes.
endoscopy, and
so it's like a
the other
camera.
one too.
We use it to look actually on the walls of the GI tract to actually identify what exactly is going on, if there are ulcerations or inflammation. Sometimes there's what we call irritable bowel disease, where there's the large intestines are constantly inflamed, or they go from inflamed, they come back to normal, inflamed again. So the endoscopy helps to identify that specific disease.
Okay. So I have diarrhea. A day or two, I'm trying to see if it will pass or otherwise. When do you actually need immediate medical attention? When do we have to go to the hospital?
Okay. Yes. So when you have symptoms of dehydration or you have symptoms of severe disease means you have a very high fever. So temperature above 37.5, maybe at 38, 39, that you have to go to hospital. If the pain is very severe, you have to go to the hospital. If there is vomiting in addition to the diarrhea, it's best to go to the hospital because it's actually more likely you will be dehydrated if you are vomiting at the same time. That means you are not able to replace what is coming out. And if there's blood in the stool, you have to go to the hospital. The symptoms of dehydration is when you feel excessively thirsty, the mouth is feeling dry, and you are not passing urine, or you urinate very little. Or you are feeling dizzy, lightheaded, you are feeling very tired, weak, and also dark colored urine. Those are symptoms of dehydration. And when you see those things, you have to go to the hospital.
Okay. Now, let's look at prevention and treatment as we wrap up. First, let's look at prevention. How do we prevent diarrhea?
Prevention, well, you can't always prevent, but what you can do is to reduce the risk. Is good hygiene practices, and especially when you are dealing with food. Washing of vegetables. Usually we eat vegetables and fruits raw, so you have to wash them very well when you are eating. And the foods you take, watch their expiry dates as well. And some people find it hard to throw food away because you keep the food, you're like, oh, but this food I can still eat it later. And you keep it in the fridge for days, and then you see some mold on top. They say,
we'll clear the mold and then we'll put it in the microwave.
So please avoid doing that. Once you see the mold and all that, please it's time to throw it.
But sometimes the kinky, when you have the mold and then you wash it and then you blend it, the masquerade they go on.
But you see, it has spores, small spores which you may not see. So when you are trying to remove the mold, the spores can still end up on it, and then you still eat it. And then when you take it in, then those are parts of the toxins that cause the diarrhea as well.
There goes my masquerade.
But you have to watch what you eat when you travel as well, and watch the water that you drink, and you just take care when you are eating food from outside.
Okay. I'll ask you about food poisoning before we go, right? I'll ask you about that. But first, let's look at treatment. How do you treat diarrhea?
Okay, so if it's not severe diarrhea and you want to treat at home, just drink a lot of water and electrolyte fluids. Electrolyte fluid can be ORS, what we normally buy at the pharmacy, or just some diluted fruit juices, or coconut water. That's the common one that a lot of people like, or some soups as well.
What about a sugar salt solution?
That's ORS.
Okay. Okay.
So that's the homemade ORS.
But how do we do that? Sometimes I wonder, like the percentage of sugar and salt to mix to get the right balance.
I should have looked it up, but I don't have it off yet. But there's more sugar than salt anyway, but it's a ratio. I'm sure you can easily find it if you just Google it.
Okay. All right. Now, I said I wanted to ask you about food poisoning, right?
The treatment at home, I'm not done.
Oh, sorry.
You have to get foods that also firm up the stool. So like dry bread, not a sandwich, just bread, or white rice, or bananas, or unseasoned crackers, like cream crackers, just dry biscuits. Or you can even take oats or rice water.
Oh, really?
Yes.
In my mind, psychologically, oats will actually give me a loose bowel.
No, that's if you add milk to the oats. But if you just take the oats without milk, that should help. And then you avoid caffeinated drinks, so Coca-Cola and those kind of things.
You know, when I'm having diarrhea, I drink Coke. No, seriously, like that's a remedy that people give, Coke and salt. It's not medical.
Well, that means they are trying to make some electrolyte fluid with it, but usually the caffeine inside the Coke, as well as the should I say the bubbly nature of it, it can irritate the surface of the bowels. So we try to avoid those kind of things. So just take diluted fruit juice. If you want to add salt to that, fine. But the Coke in itself is not the best.
Okay. All right. So on food poisoning, right? Because usually you hear people talk about maybe somebody who, I don't know the right word or technical term to use, who's been poisoned by food or has food poisoning, and make it look like somebody intentionally has poisoned somebody, right? So you take in food, you have food poisoning, which could occur because the food has gone bad or whatever. But usually we make it look like somebody has poisoned, intentionally. I want to get a differentiation. When you say food poisoning, what are we talking about?
Well, food poisoning in itself is actually the common term we use to describe maybe taking in some toxins or some pathogens within the food that causes probably a diarrhea. So it's not necessarily like being actively poisoned, intentionally poisoned by someone. Maybe the meat was taken out and then it's gone bad a bit, and then they cooked it anyway, and those kind of things. It will lead to some pathogens, and that would be a cause of food poisoning. Or maybe some chemicals used on the vegetables and they are not washed very well before making like food. So that is food. That's what we call food poisoning in general, not necessarily intentional poisoning of food.
Okay. All right. I get that. Anything to wrap up on diarrheal disease?
Yes. One thing I want to say is what you should not do when you have diarrhea. Diarrhea is the body's normal way of trying to get rid of the pathogen. So maybe if there's a viral infection or there's a toxin in there, the body is moving fast to bring it out. So when you take drugs like Imodium or Pepto-Bismol, things to try and then stop the bowel from moving, you're rather keeping the pathogen and the toxins within. So it's better to let the diarrhea take its course. So avoid those things as much as possible. Maybe you are going on a journey, traveling, and you take it so that you don't have to stop. That's understandable, but that is not a treatment for diarrhea.
Okay. All right. Well noted. Thank you very much, Dr. Emefa Dzide, for joining us this afternoon on Hello Doc. And today we've been taking a look at diarrheal disease. Thank you very much for coming.
Thank you, sir.
All right. This is The Drive with the Area Gang. Hello.